Africa CDC, in collaboration with Africa Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne l'assurance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet REDIS 4 qui est financé par la Banque mondiale. Et donc, nous allons saisir cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Et notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis, and reporting of event-based surveillance data.
la surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COUSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait et nous mobilisions des équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds, and as such, it's not something that you can just roll out in the entire country at a go. So you find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya, we have county, the subnational level governments, because they also appropriate resources for various activities. So they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers, the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département La Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with the similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.